Morning, welcome back to House Healthcare, March 14th, Friday, crossover day. Friday, and we are, what's that?
Friday.
What's Pi Day?
I love Pi Day.
Happy Pi Day.
Happy Pi Day. It's a mathematical celebration.
So we are going back to H237? No, yes.
Yes.
Yes, H237. I can't wait until Saturday. And Katie McClenn's with us. So she's going to walk us through some changes that we've made based upon testimony that we've taken and input.
Katie McClenn, Office of Legislative Counsel. We have an amendment. Let me pull it up. Okay, here we go. H273. There have been a variety of amendments made since we walked through it. They're highlighted in yellow, so I think I'll just bring us right to those changes. So if you remember, there is a chapter on psychologists, and there is a definition section within that chapter, and we're making amendments to the definitions. So a few changes. In subdivision 12, collaborating practitioner, it means a physician licensed to practice medicine pursuant to chapter 22 or 33 with a specialty in psychiatry. So that what is omitted here is the language about the board being able to identify other providers who may serve as a collaborating practitioner.
And I don't, if everybody remembers, we had concern that just anybody could be the collaborating physician. And so we're going to limit it to psychiatry.
Next is a new definition of the DSM. DSM means the Diagnostic and Statistical Manual of Mental Disorders, current at the time of practice. So it automatically updates to the one that is most recent.
Did it say DSM-4 before or 5 before?
We didn't have DSM in at all. But
Okay.
Yeah.
Cool.
Drug, we had a definition of drug, and now we're cross-referencing an existing definition of drug in this chapter, not in this chapter, in this title. There's some renumbering happening to account for the new definition, and then change to prescriptive authority. Prescriptive authority means the authority to prescribe or discontinue prescription drugs solely for the purpose of diagnosing, treating, or managing a condition recognized in the DSM. Prescriptive authority excludes the authority to dispense, administer, or distribute prescription drugs, and prescribe or discontinue prescription drugs for patients who are less than 18 years of age, over 80 years of age, or pregnant. That subdivision B was elsewhere in the bill, and OPR had suggested that we bring it up into this definition, so that's why it's highlighted. Next, in section 2, we have the powers of the board. This is where the rulemaking language is in subsection A. So there's a change here. So the lead-in language, the board shall adopt rules necessary to perform its duties under this chapter, including rules that regulate prescribing psychologist licensees pursuant to section 3019 of this title, including the settings of clinical rotations and prescriptive authority, including designation of conditions and drugs excluded from that authority, as well as requirements for the prescribing of particular drugs. And that's it for changes in section 2. Changes in section 3. If you remember, we talked a little bit yesterday of how the correct word was not licensed with regard to this authority to prescribe by doctoral level psychologists. And so where license had been used, specialty is replacing that term. And then that is clarified also in the title of this section, prescribing by a doctoral level psychologist specialty. Prescribing psychologist specialty instead of license is now the reader heading in subsection A. A psychologist doctorate may apply to the board for a prescribing psychologist specialty. The application shall be made in a manner approved by the board and include the payment of any required fees. Specialty by examination. This is well, it's been reorganized, I guess, more than new. A psychologist doctorate shall be eligible for a prescribing specialty if the psychologist doctorate, I'm gonna add this hyphen right now, holds a current license to practice psychology at the doctoral level in the state, has successfully completed a postdoctoral training program in psychopharmacology designated by the American Psychological Association or its successor, has completed clinical rotations over a total of not less than 14 months and not less than 9 practice settings, to include psychiatry, pediatrics, geriatrics, family medicine, internal medicine, emergency medicine, obstetrics, and gynecology, surgery, and 1 elective. Subdivision 4 has completed a national certifying exam as determined by rule. And subdivision 5 meets all other requirements for obtaining prescribing psychologist specialty as determined by rule. So that whole section has been reorganized and there's some addition of new language. Subsection C and again, updating license to specialty for all prescribing psychologists practicing under a prescribing psychologist specialty issued pursuant to this section. And subdivision C2, changing the may to a shall. So the issuance of prescriptive authority by a collaborating practitioner to a prescribing psychologist shall only include prescription drugs for the treatment of mental health conditions that the collaborating practitioner generally provides to patients and the normal course of practice. This is where the language had been about under 18 years of age or over 80 years of age. So you'll see that that has been removed. And then I have renumbered some subsections.
Okay, but that was put in up where they may prescribe
Right.
pregnant
So
women.
it's been,
So it just moved from here, but they're going to be allowed to prescribe medicine for both of those. They may, it said.
May not.
that they were,
May or may not.
May not.
they weren't allowed to do it
Okay,
in the old draft. And that
Okay.
is the same thing in this draft. It's just organized
it's
differently.
okay, so it's
Uh-huh.
the same. Yeah, we took testimony on that and I kind of agreed. If you're treating somebody at 78 years old, that's me pretty soon. But what do they do when I'm 80?
Well, so that was a concern and a very legitimate concern that was raised is what do you happen and what if somebody becomes pregnant when you're,
After
But-
you're in treatment.
but all specialties of prescribing doctoral level psychologists need to be working under a collaborating agreement with a psychiatrist now. So theoretically, at that point, then the collaborating psychiatrist would take over the prescribing of the prescription drugs.
Right.
Brian and then,
I don't have-
oh, okay.
Yeah, and so, my understanding, and then maybe Katie could clarify if this would be allowed under the language, would be in those cases, it may not, and it could even though the law doesn't say it be more, but if there's the collaborating provider, if there's any moment where the prescribing psychologist has any doubt, they would go to the psychiatrist and the psychiatrist would either consult or do the prescription. So that could be at any point that's allowed under this, but this specifically sets guardrails that if they're under 18 or over 80, or if they get pregnant, they must.
And that's fine, but why 80?
Well, why 18? We talked about this on the floor, raise the age, like, but the brain develops differently at different ages. The other thing is, what I like about this, and then I'll be done with this part at least,
Me too.
is that it provides that safeguard, but doesn't terminate the relationship with the psychologist. So if you're seeing the psychologist for psychotherapy and medication, which I would assume you would, because no one's going to go to a psychologist just for medication. They could go to their doctor for that. They're going to the psychologist for therapy, and the psychologist has the added benefit in these few cases of giving the medicine that they can continue that therapeutic relationship. And it's just the medicine piece that someone else needs to, weigh in on. So I think this was a decent fix.
Yeah, and can be transferred to the collaborating psychiatrist.
Yeah, without the therapy ending.
Without the
Yeah,
therapy
yeah,
ending.
yeah. Thanks.
Leslie,
I was just going to comment that there's a lot of work being done in geriatrics and how people's brains and bodies change over that age. So it's protective.
Thank you.
You can go ahead, Katie.
Yeah, I went through all the changes, yep.
Daisy.
One of the first changes you made was to add the supervising psychiatrist. With a specialty in psychiatry. Does that include a licensed psychiatrist or what kind of providers does that include?
Yeah, these are the physicians with a specialty in psychiatry.
I don't understand. I just want a better understanding of like,
Let me pull up the.
would that include as a,
Psychiatrists.
then why don't we write licensed psychiatrist?
Well, to be a physician, don't you have to be licensed?
Let's let Katie bring up, language of existing statute.
This is Title 26, so these are our professions that we regulate. So. Chapter 23. Let's see. Okay, well, we have the practice of medicine. No, that's not great. I mean, there's a scope of practice here. Do you see it? And I'm not.
No, I'm happy to go look for it myself. I just want to understand if a specialty in psychiatry, does that mean that they have additional schooling in psychiatry that's attached to a certification or license?
I would imagine so. This is language that we've used before in statute. There,
Okay.
what I was looking for is I don't think there seems to be a separate chapter on just psychiatry.
Yeah, and they're gonna redo all of those anyway. OPR is anyway.
Oh, OPR is.
Yes.
So there's not like a separate psychiatry chapter to cite to, instead of saying that there's a specialty.
But it's different that it can be more than just someone that's got a shingle out, the licensed psychiatrist. It can be more than just that title.
I mean, specialty in psychiatry, it feels like it could be a little broader. You want to like tie a degree to it, like somebody has completed a master's level program in psychiatry.
Not a degree necessarily, just a title, like when I'm going myself.
May I interject and maybe answer? In order, when you're a licensed physician and you have a specialty, you have to be board certified in that specialty to call yourself a specialist. So you're board certified by, I don't know, the American Academy of Psychiatry or whatever it happens to be. Because if you're a physician, if you list your specialty and you have a specialty, that has to be a board certification for any kind of specialty. If you're a board certified
Got it.
gastroenterologist or neurologist or psychiatry is
A board
board
certification. Okay,
certification.
that was my question, was whether it was tied to a license or certification. The reason I'm asking is because when we tie the practice and like establishing a new workforce to a supervisor, like for them to practice, are we limiting this workforce? That's my purpose of asking.
I think that I hear you, Mari. I think that the concern is the collaborating physician, as it was written, allows them to take any physician of any specialty who might not have a specialty in, a more board certification in other conditions. So you could choose, if you had an agreement with a orthopedic surgeon, that orthopedic surgeon could be your collaborating physician.
Okay, got it.
And we're limiting it to ensure that their collaborating physician is someone who actually specializes in the treatment
Psychiatric.
of psychiatric conditions.
Got it.
Mari?
And I think it's also expansive enough that you could have family practice providers who are board certified in internal medicine, but may also be board certified in psychiatry. So it's expansive enough, so it's not just limiting it to people who are just the only practice psychiatry, but there are providers that have multiple,
Yeah,
are board certified in multiple specialties.
yeah. Got it. Thank you for walking me through that.
Leslie? If it's helpful, another way you refer to psychiatrists in statute is just as you said, a physician certified in psychiatry by the American Board of Medical Specialties. So we could also use that language instead of with a specialty in psychiatry.
I think it's fine. Is everybody fine with? Okay. Brian, did you?
Well, I was gonna say, if there's no further questions, I would be comfortable making a motion unless someone else wanted to do it, like Top or, because if Top would be sponsored.
I would move.
Yeah, but I see that Lori's here now, not to put you on the spot, but like we were gonna hold the vote for you, and if we're ready to vote, we should vote while Lori's here,
Well, is there any discussion around any of the changes that have been made or any discussion at all around the bill? Brian?
I would just say that I think I know that there are some concerns and we did our best to address them. The Senate can figure anything else that comes up when they get the bill, but I'm glad we're moving forward with it because every little way that we can increase access to care, we should do it right now. As long as it's responsible. And I think there's other models out there of this. I know that there's some objection, but I feel like we're trying to meet those concerns and I think we need to move forward with it.
I move that we,
First, you have to do the amendments on a straw poll.
Thank you,
Yeah.
clerk.
But you can do that.
well, I'm gonna do the other.
All right, I move that that House Healthcare accepts the amendments that are outlined in draft 1.3.
I'll second that.
We don't need it.
Do we not need a second?
With a show of hands, does everyone approve amending the bill? Okay, 10-0-1.
Right, Representative McFawn.
I move that we approve of H 237 as amended.
We don't need a second. Will the clerk likes to call the roll?
Representative Chena,
Yes.
Representative Cordis, yes. Representative Critchlow,
Yes.
Representative DeMar,
Yes.
Representative Goldman.
Yes.
Representative Hodgson.
Yes.
Page, Representative Powers,
Yes.
Representative Rebecca.
Yes.
Representative McFawn,
Yes.
Representative Black.
Yes.
Passes on a vote of 10-0-1, and the reporter will be,
I would like the reporter of this bill to be, I'm very excited about this, Representative McFawn from Barrytown.
I accept that.
Thank you.
and I will send you an email. Then you just need to copy paste I'll tell you who.
Well, don't get me in copy and pasting.
We'll walk you through.
I'll help you do it.
Yeah.
We'll get it done.
Send in between version now.
We can use a passenger pigeon with paper.
We'll get it all done. Thank you. Thanks for doing this.
Thanks, Papa.
Thank you, everybody. Thank you very much. Thank you, Katie.
You're welcome.
Good week.